just in. 47.2% of Americans suffer from slight, moderate, or severe periodontal disease because of the presence of bacteria and lack of brushing and interproximal care. A very handy device that periodontal patients can benefit from is a rubber tip stimulator. This device was originally created because massage was thought to increase keratinization, clean the surface of the gingiva, stimulate blood flow, and squeeze fluid from the gingival sulcus. Now this interdental aid is mainly used to help with plaque removal from all surfaces of the teeth and to stimulate the tissues. It also helps with strengthening the gingiva and increasing blood circulation. Now, we welcome future RDH Kristen to talk about who will benefit from this device.
This would be a great device for patients with periodontal disease, gingivitis, or patients with furcations to remove any plaque or debris around the teeth. This device does not necessarily need to be used on patients with healthy gingiva because they are already effectively removing the plaque biofilm through their oral hygiene at-home care. This is an easy, inexpensive tool to help remove plaque biofilm. To use this interproximal aid, position the rubber tip along the gingiva and use repeated motions to break up the plaque. This can also be used to help stimulate blood flow to the gingiva by using circular motions. Next, we will move on to the clinic for a hands-on demonstration. This is a cheap, inexpensive device used to remove plaque, and this is the rubber or plastic tip with a long handle so it's easy to use. There are two ways to use the rubber tip stimulator. The first way is to take the rubber tip, and place it at a 45-degree angle along the tooth. You want to trace the tip along the gingival margin in repeated motions. This way you're breaking up the plaque biofilm and making sure it's removed. You can start in the posterior of the mouth and work your way forward with the repeated motions to make sure you're removing all of the plaque on every single tooth. The second way to use the rubber tip stimulator is to position it along the buccal or lingual side of the tooth, and once you're positioned, make sure to use small circular motions to stimulate the gingiva so it can become strengthened and to break up the plaque along the gingiva. You can also rinse between using this to make sure you're getting it all out of your mouth, and make sure to buy a new one every 3 months when you buy a new toothbrush. Now that you effectively know how to use a rubber tip stimulator, make sure you are sharing this information with your patients. Thank you for tuning in to the HCC Clinic Dental News.